The headline out of the comments from the Prime Minister is that he agrees that the federal government needs to increase its share of funding for healthcare, and therefore that the Canada Health Transfer does need to increase, but he would not pinpoint a specific time for that. He says we are going to do it, but focus remains right now on getting through the pandemic. He said that's what he communicated to the premiers. He was asked, is there a specific timeline for that? And he could not put a specific timeline on that. He just kept reiterating that the focus right now is the pandemic and that the federal government has certainly stepped up when it comes to transferring money to provinces for healthcare during this pandemic. Let's go straight to Saskatchewan and Regina, I believe, actually, to be more specific, and Premier Scott Moe, who joins us, I think, from his office. Hi, Premier. Good to see you.
Good to see you, Vassie. That's right. I'm in the Premier's office in Regina.
I appreciate you making the time. I wanted to start off on what the Prime Minister just told reporters at that press conference, that he agrees with the premiers that the federal portion of healthcare funding does need to increase through the Canada Health Transfer, but that right now his focus is on supporting provinces during the pandemic. Doesn't that make sense?
And he has supported provinces and supported Canadians throughout this pandemic. And what we have put before the Prime Minister and the federal government, all provinces through their premiers have put forward the opportunity for this federal government to really participate in a generational investment to ensure that we have the sustainability of our healthcare systems from coast to coast to coast. We put forward the numbers of where the federal government has the ability and should be participating in the Canada Health Transfer to ensure that healthcare system is sustainable for years into the future. So we would like to re-engage as premiers as soon as possible with the Prime Minister, and I'm certain, and we're encouraged that he has said that the federal government does need to increase its share of funding, but we feel we need to engage on that very early in the new year on behalf of all Canadians, and we're hopeful that the Prime Minister will as well.
It didn't sound from that press conference like he had agreed to a specific meeting on this issue, but he did reiterate that the premiers and himself meet quite frequently and have during the pandemic, and they'll continue doing that in the new year. Were you expecting a firm commitment on you and other premiers on what you had put forward today?
I would have hoped for a firm commitment to re-engage and to continue to engage on this issue specifically. Listen, this is paramount paramount on behalf of on the mind of all premiers, and I would say then on the mind of all provincial healthcare systems across the nation. This funding is absolutely required to ensure that we can keep our healthcare systems sustainable. This funding has to come before we move forward with any additional programs or additional measures that the Prime Minister, the federal government may want to move forward on. This is the very crux, the very foundation of how we deliver healthcare across this nation. The precedent has been set in years gone by, and we have put forward what we believe is a very achievable proposal in front of the Prime Minister, and we'd hope that he would accept it, or at the very least engage on something that is so important to all Canadians.
It doesn't sound like that's coming in the next year, although the Prime Minister did acknowledge, as I mentioned to you, that it's necessary for it to happen, that there was no specific timeline put on it. If it can't happen this year, understandably so, some might say, because of the pandemic and the expenses associated with that, are you okay with something, for example, beginning 2 years from now?
Well, we should start with the discussion right now. We've been asking for this meeting. All premiers have been asking for this meeting with the Prime Minister for some time now. The premiers have done and the provinces have done a substantial amount of work around what the right number is in formulating the request that we have in front of the federal government. This most certainly is a discussion that, yes, is for the longer term health of our healthcare system. But the conversation needs to happen, and it's quite urgent that it happens sooner rather than later. This should not be waiting years. This needs to happen sometime in the new year.
I take your point, and I understand the ask of the federal government. Is there a conversation happening within your own province about, if the expectation is a larger federal contribution, that the province is going to have to spend more on healthcare as well? I think back to, I know you weren't premier then, but you were in cabinet 2017 when there were cuts to healthcare. For example, long-term care subsidies, the fees for about half of all residents increased about $600 at that time. There are being cuts to amalgamate health regions to save on administration costs. Are you prepared to spend more if you expect the federal government to as well?
Well, let's be clear. In Saskatchewan, Saskatchewan, the healthcare budget has never been cut. There have been efficiencies found to ensure that we are providing and aligning our service across the province, and to ensure that the healthcare is as sustainable as it possibly can be. But each budget, each and every year in Saskatchewan, has been higher than the previous budget, and we're very proud of the investment that this government has put forward, not only with the infrastructure in our healthcare system, but also investing in people across the province. What we are asking to do, and I think many other provinces have a similar story to tell, what we're asking is for the federal government to become a full funding partner in the healthcare delivery services across the nation. When we began with the Canada Health Transfer, it was a 50-50 partnership. That has slipped down to about 22% federal funding, and what we've asked is let's bring that back up to about 35%, ensure it's sustainable, ensure it's there not only for the next decade, but is going to be there for their next generation.
Can the federal government, from your perspective, attach strings or some sort of standards to the money it provides? I think most taxpayers, most citizens in this country would understand if the federal government wanted to make sure the money it was giving to your province didn't result in further cuts to healthcare, for example, didn't result in going only to one aspect of healthcare. Does that sound reasonable to you?
If the federal government wants to implement new programs or additional programs that they would want to put some parameters around, they could do that after they become a full funding partner in the Canada Health Transfer. Right now, they are at very best a minority partner in delivering healthcare financially across this nation. They need to rectify the challenge that's before them before we start talking about putting parameters around any additional programs like pharmacare, like long-term care standards that the federal government is talking about. One conversation most certainly has to come to a conclusion before the second.
So you want a commitment to an overall increase before you'll even discuss standards?
That is what needs to happen. We have the very foundations of our healthcare system need to be addressed and need to be addressed by the federal government. That is why the provincial premiers have put forward the very reasonable ask in front of the federal government to participate in delivering healthcare across this nation, and to do so as a full partner.
Okay, Premier Moe, I'll leave it there. I appreciate your time this evening very much.
Thank you.
Scott Moe is the Premier of Saskatchewan. We are going to swing right across the country, in fact, to Halifax, Nova Scotia, where the Premier of that province, Stephen McNeil, joins us now. Hi, Premier McNeil. Good to see you. Thanks for making the time.
Thanks for having me.
I'll start off with the same question I asked Premier Moe. We just heard the Prime Minister address reporters, and he said he conveyed to you and your colleagues, your counterparts rather, across the country, that he was willing to increase the Canada Health Transfer, that he does think that the federal share of healthcare funding should increase, but that right now his focus is on the pandemic. Doesn't that make sense?
First of all, we were pleased to hear the national government acknowledge they need to contribute more funding when it comes to delivering health care across the country. I think all premiers were pleased to hear that. Like all of us, this pandemic is taking on all of our time as we're focused on it. But that does not mean that we can't have a parallel conversation about long-term or about how we fix the healthcare system. Let's be frank, our system is not just, it wasn't the pandemic that just caused all these issues. I've been here 7 years now. We've continued to see funding being reduced from the federal government. If you look, Premier Moe just talked about 22-cent dollars. When we started out, we were equal partners. The cost of this continues to escalate, but our other partners reduced by over half their contribution. This system needs to be transformed in a way that reflects 2020. And in order for us to do that, we need to help the national government.
Premier, you also heard Premier Moe talk about, I had asked him about the possibility of standards or strings being attached to the money that's transferred from the federal government. I think a lot of taxpayers across this country would want to know for certain where that money is going, and that there will be, a good effect to it being transferred. He was not okay with that occurring prior to an agreement simply from the federal government to increase the CHT. Where do you stand? Are you okay with those standards prior to that agreement?
I have no issue. The federal government wanting standards across the country. We all follow the Canada Health Act. If you look at the investments we're making, it's not an issue at all. But the reality of it is that 22 cents on the dollar, we need them to invest, and we need to have this conversation now. This is an opportunity, quite frankly, to transform the system. This pandemic has certainly shown some issues that we have within delivering a system and how it's different all across the country. But let's not lose sight of the fact that prior to this pandemic, there were issues in our healthcare system, and Canadians deserve us to be focused on this. And we can do these at the same time. Whether the funding starts coming out in 3 months or 4 months or 8 months is one thing, but the conversation about what that looks like and how we start transforming the system needs to happen now. And in my view, needs to happen at the national table, not on bilats. It needs to be where we can all come together and talk about what are the standards that you're referring to? What are the standards of national government and what are their priorities? And let's invest in them.
I know you're talking about sort of a structural issue between the federal government and provincial governments, but I'm wondering from your perspective as well, if you do expect a larger contribution from the federal government, are you too willing to start funding healthcare to a different degree? I'm thinking of the budget that you put forth right before the pandemic, which did increase funding from $4.7 billion to $4.822 billion. The Nova Scotia Health Coalition, though, said that increase keeps pace with inflation, but does not offer a significant increase in real-world dollars on healthcare. You've also promised to cut the corporate tax rate. Are those decisions that are in line with properly funding healthcare?
We've continued to make investments in healthcare in every budget. The issue becomes when your partner that you're with is who goes from a 50-cent dollar to 22 cents, there has to be adjustments made. And I also would say to you, this is a time for Canada. This is a time for governments of all stripes to look at how do we change the delivery model. You quoted my budget. Prior to that, I closed 2 emergency rooms in Cape Breton Island and enhanced one at the regional. I had 3 emergency rooms that were in 30 minutes of each other. Well, that might have worked back in 1950. It doesn't make sense to deliver healthcare that way today. So all of us have to look at what we can do internally. You look at whether it's been in this province or across the country, provincial governments have had to make the way we deliver healthcare look differently. We're doing virtual healthcare now, where a doctor can have an appointment with you at home. That's not driving down the cost of it, but it's the way Nova Scotians want it delivered to them. As a matter of fact, the cost of delivering that is going up. That's all this conversation needs to be about. How do we transform a modern healthcare system to reflect the reality today? And I would say this, Vashi, to you and all your listeners. Where else in our life, in any part of our lives, do we accept the same standard and the same delivery model that our grandparents had? Think about that. Nothing else in your life, no matter what you do, whether it's driving a car, going to work, how you get your information, what you do, is the same as it was for your grandparents, except delivering healthcare. We need to modernize the system. And this is our opportunity. In order to do that, we need the national government at the table to partner.
So it doesn't sound, though, from what the Prime Minister said, that he wants to have that specific conversation early in the new year. He says he's still really focused on the pandemic. It also didn't sound like there was a specific timeline associated with his promise to increase the CHT. Does that worry you?
Listen, we need to continue this. We need to have this conversation now. And let's go from the positive point here. The national government acknowledged it needs to be a bigger contributor to delivering healthcare across this country. That's a positive step, an acknowledgement on behalf of the federal government. The Prime Minister wants to have the conversations that we're having around the pandemic to be the priority. We can still have those conversations at the same time, though, that we're looking at the entire system of delivering healthcare. There's no issue more important to Canadians than delivering healthcare. And I believe we can do them at the same time. And I'm hopeful that the national government will come to the table sooner rather than later to start that discussion about what does a new delivery model of healthcare look like in Canada.
Okay, Premier McNeil, I'll leave it there. I do appreciate your time this evening. Thank you very much.
Thank you very much.
Stephen McNeil is the Premier of Nova Scotia. We've been discussing the First Minister's meeting and the lack of an agreement to immediately increase healthcare transfers to the provinces. For some reaction to those comments from the Prime Minister, we're joined now by Blaine Higgs. He's the Premier of New Brunswick and joins us from Fredericton. Hi, Premier. Good to see you.
Good evening, Ashley.
That was a pretty clear commitment from the Prime Minister that money to provinces for healthcare needs to increase and that will happen through the Canada Health transfer. Is that what you were looking for?
Well, certainly that is recognition, and to start on that basis that yes, there is a shortfall there that all provinces are having, and we need to make that up. So that's certainly a start. We didn't get the commitment of what that might look like, and we wanted to end up with a timeline for the next meeting, which hasn't been confirmed at this stage, but I believe the confirmation is certainly helpful. Its recognition and the willingness to keep talking is important. But every province and territory has this challenge, and we can't ignore it.
I was speaking with the Minister of Intergovernmental Affairs, who was also on the call and in the meeting earlier today, and asking him about sort of next steps and whether or not there would be a meeting focused directly on it. Doesn't sound like there's a commitment from the feds to meet specifically on this issue again early in the new year, at least. But he said finance ministers, for example, would get to work on trying to come to some agreement over the funding formula. Does that satisfy you?
Well, you're right. There isn't a path forward on the next meeting, and we very much were all in sync with having that happen. So I think we have to be, thankful for what has been achieved so far in recognition of the vaccine, and the federal government is going to pay for that, and the distribution to our provinces. So that. Good, and we want to get the vaccine rolled out, but we have to do some things in tandem here because this issue around long-term sustainable health, it's about using dollars wisely. We talked about sharing best practices across the country so that if what one learns, another can learn from, not reinvent. And I think we've learned a lot through COVID that we want to change kind of the way we deliver services and our ability to have flexibility from federal funds to do so. So we were trying to get away from the prescription of oh, well, this is federal money, we need to do it this way. Let's have more flexibility with the dollars already being spent, as well as recognition as we need to find fill this gap between our current spend and the level of ongoing federal participation.
I want to ask you what you just mentioned around flexibility, because there's a big part of this conversation is if there is extra money transferred to the provinces, are there standards, for example, attached in certain instances? Is there a commitment from the provinces not to make cuts of their own to healthcare or to do certain things with the money? Are you amenable to a conversation about that?
Well, yes, I would say yes, Vashi. In relation to understanding healthcare standards across the country, I mean, that's something we cherish as Canadian citizens, that we all can provide equal services and that we can have the same level of healthcare in any region, in any province, I should say. And in that relationship, yes, we could have those discussions. But I think what has to be careful is that because these are provincial jurisdictions, federal government prescribing like this is what you're going to do. And if you look at long-term care and you say, well, this is what you're going to build now for long-term care facilities. Well, we didn't all have the same challenges. So in that sense, well, I don't need to build a whole lot of new buildings when my philosophy here and our philosophy in long-term care is keep people in their homes as long as we can, provide better services for people living where they want to live, not build a new building that would be empty in 20 years. So I think we just want to be able to have flexibility in what provides the standard of care, not just build more infrastructure, because that's the federal model.
I take your point on that, but could you understand, I guess, the concern for people across the country whose tax money will be used to help this endeavor, obviously to aid in their own health care, though, but in trying to make sure that money goes to the right things. And I know, for example, a story that came out today in your province about some long-term care homes that struck a deal with the provincial government that allowed them to lower the ratios of staff per resident, something like from originally 3 staff to 18 residents to 1 to 18. I know that pilot program was eventually canceled, but certainly if you're going to get more healthcare money from the federal government, the provinces will have some responsibility there too.
Well, yes, they would, and there has to be a certain level of standards. But I think the standards have to be very focused on what care is being provided, not necessarily prescribing how it's being provided, but what is the outcome. So yeah, in the particular understanding of what works and what doesn't work, part of the challenge is the people that we're going to be able to get to provide these services. We're all being challenged by resources. So another discussion, and I'm talking human resources, another discussion was in relation to immigration policies and how we can, speed that up. because it's not, we are all challenged for the same number of people. And in New Brunswick, our demographics, and certainly through the Atlantic region, are such that, our province is aging faster than other provinces. And that's a kind of a factor of our demographics in New Brunswick, which in turn has higher health costs related to that. So we'll have to be able to manage our particular situation.
Knowing what you know now about how the situation that has unfolded in so many long-term care homes, do you regret that pilot program?
Well, I think I'll always want to look at how we can understand better service levels, and I'm never afraid to look. And sometimes I take a lot of criticism, and people would say, well, you can't change this. Well, we have to look at changing. But some cases it'll require more resources, in some cases it may require less. But we have to look, and I would dare say going forward, we just have to work with operators and people that are more, in the case of the healthcare world, much more knowledgeable than I, can suggest ways to meet the challenges. Because it just spending more money is an issue, because it's a problem I'm concerned with in the federal government. With Alberta's situation, who were always a major contributor to the federal coffers, and with potentially other provinces coming in a situation that require equalization. Where's the money going to come from at the end of the day? And that could be another big hit on our resources that we're saying, okay, how do we manage all of this? So we ask for clarity on both fronts. Money for the healthcare long-term, understanding those standards and what we can minister provincially, and long-term revenue in terms of our equalization and how that's going to work under a formula where there may not be the same contribution economically to the federal coffers.
I certainly understand the point that spending more doesn't necessarily mean a better outcome. I think particularly, though, just given what we've seen over the pandemic, this story might have resonance with people because they've seen kind of what has happened in long-term care homes and how vulnerable they were and how staffing is a part of that. That's why I ask if you now, knowing what you know now, and I understand you may not have known that then, regret that kind of pilot program.
Yeah, and I appreciate what you're saying, and we fortunately, and certainly at this point, and hopefully we won't experience that same situation as we've seen in other provinces. We have had some challenges in some of our long-term care facilities, but they've been controlled. So I guess you look at that too and say we've done our healthcare professionals have done an admirable job. So did we learn anything from that? Did we learn we need to do something differently? But don't just dismiss what has been accomplished in these facilities to date and say there's a whole new model coming. That would kind of be my point, because I think we can look at what we have and say, it's worked quite well. Let's just figure out how we can do better going forward, but not necessarily just throw it out for a new model.
Okay, Premier, I appreciate your time as always tonight. Thanks very much.
Thank you, Vashi. Have a good evening.
You as well. That's Blaine Higgs. He's the Premier of New Brunswick. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.